been a long time, members, and massive apologies that we haven't been able to give you a regular update on the memo. Proud to give you this update, and it'll be a series of updates that I myself, Deveri Henna, will give you an insight on how the year has transpired and the critical activities that we're embarking on. So today, in this particular edition, we're going to focus on the COVID-19 vaccine survey that we undertook in June, and subsequently what's transpired from that initial grab of the data and what's transpiring in the marketplace. So for a full appreciation on the vaccine survey, have a look at our YouTube channel. The link is there below, and feel free to tap on it and you'll get an entire appreciation on the numbers. Or if you do want to read the report itself, again, have a look at our website. We've got the full report published on our website as well. So just a couple of key features that came out from that survey. Number one, there is an overwhelming desire that chief executive officers right across the market have their preference on safe workplaces, open markets, and vaccinations is the recent strategy that they would like to deploy in their workplace and their work environments. Now, this is of course on top of last year's focus on the nuclear passing protocols, or to be accurate, the non-vaccination protocols that businesses have applied, which is your hand sanitizers, your face mask wearing, social distancing. When we asked the chief executive officers how many of their, what was the budget that they spent on this, it was between 70,000 kina on buying face masks, hand sanitizers, to roughly 200 to 300,000 kina on retainers of doctors and medical staff, to full-blown 5 million kina capital expenditure on building clinics and including ventilators and other oxygen and other mobile health clinics that were there. So the message that is coming out very clearly is in business continuity plans already we have seen a large investment undertaken on the nuclear passing protocols. The market has completely adjusted and implemented these protocols in 2020-21. When the vaccines became available in 2021, we have now seen a major interest by the chief executive officers to deploy them in their workplace environments. So this is an important observation where, as technologies become available in the market, we are seeing businesses acquire these technologies, or through government-led initiatives encourage their workers to have vaccines and then apply them into their workplace environment. So the COVID-19 survey for vaccines for business indicates this strong shift in vaccines being a major strategy in the workplace space. Now that was in June. What we're now seeing in October is there is now a major push and a major confidence in the vaccination drives. Unfortunately, due to the Delta variant, which is having a major impact across particular provinces and the market in general. But the increase on vaccinations within the workforce is a positive sign. And we're now beginning to see, especially those sensitive value chain operational sectors, 24-hour, 7-day operation sectors, they are now having a mandatory vaccination drive. And that's completely understandable given the fact that those value chains, if and when they are disrupted by large, skillful sectors of their operations, the entire business does and will shut down. So certainly, in those areas of workplace relations, we're beginning to see that sort of application in their value chains, and we will definitely see more of that. The mining and the oil and gas sectors have deployed similar bubbles, and we're beginning to see the success of those bubbles in their operations, um, where the continuity has occurred because of the confidence and the workplace safety confidence that the vaccinations have provided. Again, just highlighting the critical persons list. This was the driving factor for many CEOs, all the CEOs, on the vaccination drive to protect their critical workers. What's interesting to observe is the critical workers are not segregated to management or staff or even gender. They are actually the type of work and the scope of work that employees and employees undertake. So just to name a few, those that domestically and internationally frequently travel, their jobs take them around. Also, um, they are critical skills within that value chain that they are making the emphasis for their vaccinations to be placed. So again, the key thing that is coming out is, especially in the month of October and probably going in the next couple of months, there is an increase, a heightened increase, personal choice by employees and employers getting vaccinated, because that's allowing them to um, be safe in these Delta variant times that they've seen and they've observed their relatives and their families having the impact on the Delta variant. The second part is also on the nuclear passing protocols. We're beginning to see technological advances in masks, technological advancements in aerosol sprays, and other forms of detergents coming out in the market that can be deployed into air conditions or vents, and again, hand sanitizers as well. All of these are becoming readily available in the market, and we're also seeing an increase in the acquisition of these, um, COVID-19 slash new types of technology, non-vaccinated spends coming through in, in October in particular. And then lastly, a very important part is the narrative of wellness and eating healthy, staying healthy. The non-communicable diseases is still a major killer in the country, whether it's heart disease, diabetes, or even tuberculosis. These are the ones that are creating symptomatic patients, and COVID exacerbates that. So the drive on wellness programs, we're seeing that increasing around the marketplace as well, where part of the COVID-19 health drive is also connected to this wellness and healthy lifestyle drive as well. So 2022 will definitely see a combination of vaccination drives. We'll see a combination of the new technologies on masks, on aerosol and other types of products that can be applied around workplaces, and also the healthy lifestyle drive as well. And this is where we're beginning to see significant alignment with many businesses opting to have these sorts of investments going forward in their the protection of their workplace. So stay safe, everyone, and thanks for tuning in on this edition.